Hey everybody, it's Dr. Johnny. Welcome to today's episode of The Truth About Fat Loss Summit. And today we're going to be talking with Dr. Brian Mowll, the diabetes coach. And I'm so excited to be doing this because, Brian, you've interviewed me a number of times for your legendary summits on diabetes. And this is the first time I'm getting to interview you. And we have so many things that I'd like to ask you. And so first of all, welcome and thank you for being here. Brian, I should say, is a certified diabetes educator, but more importantly, he's certified in functional medicine. And I think, Brian, that would be a great place to start. We've certainly talked a lot about functional medicine in the course of the summit. People have heard it referenced. What is the difference between the way a conventional diabetes doctor will treat or look at diabetes and how someone who is certified in functional medicine approaches it? I think that would be a great place to start. Could you tell us that?
Yeah, absolutely. And it's a huge distinction, really, because conventional diabetes care, I think today leaves a lot to be desired. I'm sure you would agree with that. Mainly, they're focusing on what are called the standards of care. And the standards of care are essentially designed around driving blood sugar down. And type 2 diabetes in particular, and anything along that spectrum, so the sort of the metabolic dysfunction spectrum, prediabetes, metabolic syndrome, and certainly type 2 diabetes, it's not just high blood sugar. You know, that's a myth. It is sort of diagnosed that way with high glucose in the blood, but it's much, much more than high blood sugar. In fact, there's a name for high blood sugar, and that's hyperglycemia. That's not the same as diabetes. If they were the same thing, we wouldn't need two terms. Diabetes and metabolic syndrome and prediabetes are much more complex than just high blood sugar. In other words, there's a variety of organs involved with that. We have to look deeper and say, why is the blood sugar high in the first place? And more importantly than that, why is this person not able to regulate and control their blood sugar properly? That's called blood sugar dysregulation. And from a functional medicine perspective, that's what we're going to look at. We're going to say, what is the root cause? Why is this person not able to regulate and control their blood sugar? And how has it gotten so bad that now the blood sugar has actually started to elevate to the point of they can no longer keep it down on their own? Now, again, the conventional medical approach for diabetes would be to use basically hypoglycemic medicine, so drugs that will lower blood sugar. And there's a whole host of those, including insulin, that will do that. But again, I think you're missing the mark. If you're just trying to suppress blood sugar with conventional medical care, and you're not doing really anything to address lifestyle, and all the other factors that can contribute to why the blood sugar got high in the first place in diabetes, then I think you're missing the mark. So in functional medicine, we take that extra step, which is that all-important extra step, and say, why? Why does this person have diabetes? Why can they no longer regulate and control blood sugar? And then that opens like a can of worms, right? So the why is looking at gut, looking at liver function, looking at the pancreas, looking at hormone balance like thyroid and adrenal hormone regulation, looking at muscle mass, muscle function, how all these things relate to this delicate interaction between glucose and insulin and hormones like cortisol, which ultimately allow us to be able to control and regulate our blood sugar properly.
It's a great answer. And while we're batting 100 on getting you to give us great definitions and basic explanations and stuff, for those who might, I think most people listening to this have some awareness of the connection between diabetes and obesity. We even have a term for it. We probably used it a few times in the summit, diabesity, because of the similarity of the origins of these two things. Could you tell us, for those who might be listening to this and going, I don't have diabetes, I don't even think I have prediabetes, what's the relevance to me? I just want to lose weight. Could you talk us through the connection between diabetes, prediabetes, and weight gain, how that's all connected?
Yeah, absolutely. And I'm so glad you brought that up because there are a lot of myths, as you know, in health and diet and so forth. And one of those myths is that being overweight causes diabetes, or if you have the wrong genetic makeup and you gain too much weight, you will get diabetes from that. And that is not true. Now, they are related. And as you mentioned, there's sort of a common cause, which we'll talk about, but it's not the overweight or the overfat that causes the diabetes. There's actually something that causes both of them, and we're going to talk about that.
Good.
But that's important because you can be obese and have normal blood sugar control. You can have diabetes and be normal weight, even type 2 diabetes. And a lot of people don't realize that. And this is so pervasive. I hear doctors talk about this all the time. Clients, patients will come to me and say, my doctor says if I just lose weight, I can get rid of my diabetes. Or I'll have people say, I thought that if I just lost weight, or my doctor told me if I just lost weight, I would get rid of it. I did lose weight, but my blood sugar is still high. So they are related, but they are not causal of each other. So diabetes doesn't necessarily cause weight gain, and weight gain doesn't cause diabetes, and you can have them independently. You can be obese without diabetes. You can have diabetes without being heavy. Now,
right, but is it not true that maybe 80% of diabetics are overweight? I mean, granted, there is
right.
that kind of almost an anomaly, the tall, thin guy who's got diabetes, and I've known a couple like that.
Yeah,
but it's less common,
right?
There's more of an overlap between weight gain and diabetes than we might think. Is that not?
Absolutely, and even the people that you mentioned that are of normal weight or seem thin, they many times do have fat accumulation around the organs. It's just deep, so it's underneath the muscle, and sometimes you can't see it.
Yeah.
So if we check their body fat percentage, for example, with like a bod pod or some accurate way of doing that, you'd find out, or you do an MRI is what they really do to look at this. You find out, oh, look, they've got a lot of fat packed in around the organs. So there's definitely a strong connection. And the connection point, which you and I have spoken about before, is this hormone called insulin, right?
Yeah.
So insulin is the insulating hormone. It's the hormone that causes us to pack in fat around our organs and over top of our muscles as subcutaneous fat. And insulin is important. It's not an enemy. It's important. In fact, it's biologically, I think, was the first hormone to develop, or at least the first hormone that we know about to develop. And it's there as sort of a protective mechanism. So during times when food was scarce and we didn't know if we were going to have our next meal, I'm speaking about sort of from a evolutionary biology perspective, when we went through long periods of famine, for example, insulin was there when we did have food to take anything extra that we couldn't use or burn at that time, and then to sock it away, right, into our fat stores. And that's important because, again, we may not be able to eat again for 2 or 3 days, so then we can start to utilize that. So what happens is when you eat a lot, when you eat either extra calories or extra just food mass or extra carbohydrates, insulin rises. That we use that to take that extra energy, those extra calories and carbohydrates, and we sock it away into storage, into fat cells, and those can be either visible or they can be deep fat cells around the organs, which is even more dangerous. And then when we have times where we don't eat for a while, insulin levels fall, which allows us to start to burn that fat for energy. Now, in today's world, what happens, unfortunately, is we have periods of overeating and we have lots of extra energy, but that's not balanced by those periods where we don't eat for several days at a time or we have less food. So insulin never drops. It just stays high. And in fact, the term for that is hyperinsulinemia. hyperinsulinemia. It means there's too much insulin in the bloodstream. And when we test our clients, they almost all have high insulin levels, even those with full-blown type 2 diabetes. So what that means is they're making too much insulin. The insulin is never coming down. So rather than being able to burn that fat, they just keep storing. You've talked about insulin as sort of that blood sugar Sherpa, which is there to transport sugar in and out of the fat cells. It's kind of like a doorman, right? So when there's insulin present, it actually doesn't allow you to burn the fat. There's a lipase, an enzyme that allows you to break down fat from the cells, and in the presence of insulin, that enzyme is not active, so
right.
You don't burn fat, right?
Yeah, and that hormone is hormone-sensitive lipase. Is that?
That's right.
Right,
that's
okay.
right. Hormone-sensitive lipoprotein lipase. So that's a key. So what happens is there's this sort of central cause. We overeat. Again, that could be just too much food in general. It could be too many carbohydrates, too much processed foods that are hard to break down, like hydrogenated, partially hydrogenated fats that our body just doesn't really even know how to utilize. We got all this extra energy, and so insulin levels rise. And then we just get stuck in this pattern where we have too much insulin. We store fat and at the same time become resistant to that insulin, which leads us to become diabetic.
So there really is quite a connection between, and the connection seems to pivot around, the smoking gun seems to be insulin for
Absolutely.
both obesity and for diabetes, at least in 80%, most cases.
Yeah, and of course, just to differentiate, type 1 diabetes is a complete lack of insulin. And
Right.
This is where people get confused. They say, wait a minute, I thought it was not enough insulin, not too much. Well, in type 1 diabetes, that is the case. And so they're thinner because they can't store energy. Mm-hmm. And at the same time, they can't take the sugar out of their blood. So type 1 diabetes is completely different. Obviously, in type 2, it's what you just said. It's too much insulin, and insulin really has become the problem.
And what's interesting to me, there was a article in the New York Times in the science section a couple weeks ago on a condition that they're calling diabulimia. These are diabetics who also have eating disorders. And they asked one of the teenage girls that they interviewed for the article, what do you do? How do you do your bulimia? She says, I skip my insulin. So that should just tell you, even at like at the teenage girl, who doesn't know the biochemistry, she's figured out that insulin puts weight on. And when she skips her insulin, of course, nobody's recommending this, folks. Don't do this
Sure.
at home. It's a life-threatening thing. But the point is that insulin really is a fat-storing hormone on many levels, is it not?
Absolutely. And we see, some of our clients who are on insulin. This is just a really difficult balance because, they've gotten to the point where their body has become so insulin resistant that they no longer respond to their own insulin. They have to start taking massive doses of insulin just to get their blood sugar down to a reasonable, healthy range. But of course, the whole therapy doesn't make much sense because they're insulin resistant. They already have too much insulin. Now we're pouring more insulin onto the fire. It does work in the short term to get blood sugar down, but in the long term, they gain more weight, become more inflamed, have more cardiovascular stress, and ultimately, there's just no end in sight. They end up taking, I've had patients and clients come into my office on several hundred units of insulin a day, which is absolutely insane. And that's the only way they can keep their blood sugar down until we really start to address the root causes.
Yeah, it's really heartbreaking whenever I hear that. And, you can imagine me, a nutritionist without an MD, and when I was in private practice and I would see people and your doctor put you on insulin, and that's what my doctor said to do. And I would just want to either cry or tear my hair out. I don't know which. It was, it certainly is not, doesn't seem to me to be a very forward-thinking way to treat this condition. So let's talk about what you would do when you see somebody whose insulin carbohydrate metabolism isn't working quite right, and maybe they're gaining weight, or maybe they're even pre-diabetic. What's the intervention? What do you do other than fill them up with more insulin, which obviously neither of us thinks is a very good idea? What do you do?
So when I approach a case, we have 3 stages, and stage 1 is normalizing blood sugar, and that's important. It is normal. It is important to bring your blood sugar as close to normal as possible. Stage 2 is about reversing the type 2 diabetes. So then it's about improving health, addressing the root causes, transitioning off of medication with their physician's help, and then stage 3 is about maintaining that, so learning to continue to stay healthy long term. That first stage, though, when we want to normalize blood sugar, there's a couple important things about that, and this is where, if we're going to support the use of medications, this is where we're going to support them, because it's harder for many people to get blood sugar down naturally than it is to keep it down. So, and I'm talking about people who have blood sugars sometimes in the 200, 300, 400 range, where normal is about 80 to 85. So it's very hard sometimes for people to, now, some people, if they're drinking soda, if they're eating a bunch of junk food and candy and pizza and carbohydrates, sometimes just stopping those foods will be enough to make a huge change, and they don't really need the medications. But a lot of my clients have already made those changes. They're not drinking soda, they're not eating junk food, but their blood sugar is still elevated because at this point, their system has become damaged. And so sometimes those medications can be helpful initially to get the blood sugar down, and then we want to work to keep it down naturally. So that's sort of the first stage, and that's where, if you're going to take, if you have diabetes and you're on a drug like metformin or a Januvia or something like that, these drugs work in different ways to help your body to bring sugar down. And sometimes they can be helpful, but it's not a long-term solution in my mind anyway.
Well, then are you saying, in other words, if somebody really cut carbohydrates to a very low level, let's just say Atkins stage 1, 20 grams a day, something, or, even under 50 grams a day, which is a pretty severe cutting of carbohydrate calories, would their blood sugar not be expected to normalize just out of that? I mean, after all, you're no longer eating the foods that are driving blood sugar up, so therefore you would think you're no longer going to be driving insulin up, and that's really the name of the game when it comes to healing this metabolic irregularity, if you will. So why would a low-carb diet not be effective against this?
Yeah, it's a good question, and it sort of depends on how far you are into this progression. So if you're in this pre-diabetes stage where your blood sugar is elevated, but it maybe in the low hundreds, but it hasn't sort of jumped really high, or you're in a metabolic syndrome stage where, again, same thing, your blood sugar's elevated, you have some extra fat, particularly around the belly, high blood pressure, high cholesterol, that type of thing. At that stage, you can make significant changes to the diet, and that can reverse it overnight, within a week or two. What tends to happen is people will be pre-diabetic for years. So if we were to check somebody's blood sugar longitudinally, like every 6 months for 10 years, it might gradually go up or hover in this sort of high 90s, 110, 115 range. Something happens where the system breaks. Now, it's not a permanent break, but it breaks. And so this is what we typically see, Johnny. People will have this prediabetes range, and then all of a sudden, out of the blue, their blood sugar will jump from 115 to 180. Wow. Or 250 or something like that. Unexpectedly
and without any antecedents that you could point your finger at.
Well, sometimes there are. Sometimes there are antecedents. Like sometimes it's a major life change, so there's been some stress. They change their work hours and start working nights. Sometimes it's a period of they were eating pretty well, and then they sort of went off the bandwagon, so to speak, and sort of went into a period of overeating, and that sort of drove it up. Sometimes it's a drug or medication, like I've seen hydrocortisone treatment do this. People have autoimmune disease and they get on like a prednisone or something for 6 weeks or 6 months in some cases, and that can be the thing that drives it. Sometimes it's a thyroid disorder that they didn't know about, like they have Hashimoto's, autoimmune thyroid dysfunction, and that took a turn for the worse, and then that triggered a blood sugar crash, basically. And when I say crash, I don't mean low. I mean it was sort of, there's usually, like the expression, the straw that broke the camel's back. There's usually some sort of triggering event.
Interesting. And then all of a sudden now it jumps.
And it jumps. And so that's the birth of type 2 diabetes. Now they are a full-blown type 2 diabetic. And we see that more commonly than the person that goes from 100 to 105 to 115 to 120 to 130 to 140. Usually it's a jump. So from a conventional perspective, just to give people some understanding of how their doctors view this, they look at that event because it's common knowledge, even in conventional standard diabetes care, that can happen and does happen. They look at it as that's when the pancreas stopped working. So that's when the pancreas has had enough. It went into basically default and stopped making insulin. So that's how it's viewed in the conventional diabetes community. But I don't believe that. And the reason I don't believe it is because if we test those people's insulin levels, they're still high. So their pancreas is working. It's just not able to keep up with the demand or the level of insulin resistance. So I think something happens that just breaks their system. And when we look at the system, it's a balance. It's a balance of hormones like cortisol and adrenaline, which are made by the adrenal glands. They raise blood sugar. There's the liver, which takes all this stuff in and processes it. And the liver can break down muscle tissue and turn that into sugar. It can just dump sugar right out of the liver into the bloodstream if it feels like it wants to or needs to. And then the insulin made by the pancreas has to act on the cells to allow them to absorb the sugar out of the bloodstream. And so, and then the muscles, same thing, have to uptake that glucose. So there's a balance between all these different systems working together, and something happens there that balance breaks. And so it's in those people that just changing diet, just going on a low carbohydrate diet, not that it's not effective, it does help a lot, but it may not be enough to get the blood sugar back down to normal at that point.
Then what do you do then?
So then we have to start looking for other things. And that's where, again, a functional medicine approach like we talked about in the beginning really helps, because we have to look and say, where is this system broken? So diet is a big piece, but how is the liver working? Maybe some of the detoxification pathways of the liver are impaired. Maybe there's fat packed in around the liver, so even though they've changed their diet, the liver's not able to function like it once did. Perhaps the cells have become so insulin resistant that even on a low carbohydrate diet, the cells can't take in even the sugar that's being made. Maybe the hormones are so far out of balance that there's a constant trigger for the liver to dump more sugar into the bloodstream because the body is in this perceived stress state. And so it's about addressing all of those things, looking at the gut, making sure the gut's healthy and the communication between the gut and the hormonal system is working well. Looking at hormone balance, making sure that cortisol and adrenaline and thyroid hormone are balanced and working well. Looking at the liver, making sure that it's detoxified and clean and that machinery, that metabolic machinery is working well. Making sure that the muscles are able to take in glucose and burn it for fuel rather than being resistant to it. So looking at all these areas, and And again, maximizing the health potential in all these areas. And then it's small changes. You absolutely have to start with the right diet, because you can do all that stuff, and if you're still eating a high carbohydrate diet, guess what? Your blood sugar is not coming down. And in fact, it's going to make things a lot worse. Same thing with exercise. You have to move the body. If you don't move the body, you don't build up lean muscle mass, then you're not going to have the ability to burn that glucose, that even whether you're eating it or making it. So those things are important, and those, that's sort of a good starting point. But then if that's not enough, which oftentimes it's not, we have to kind of look at some of these other areas as well.
Well, to give people a little bit of hope and optimism here, obviously you've just really characterized the whole functional medicine approach to diabetes better than I've ever heard it characterized. Looking at all those things that could go wrong once something's broken. But I think it's important for people to know that it's not always that dire. I interviewed Bill Davis, the cardiologist who wrote Wheat Belly, for example. I don't know if you've ever met him. He was a type 2 diabetic. He's a cardiologist who was diagnosed with type 2 diabetes. And, the whole Wheat Belly thing and looking into wheat and its effect on blood sugar and all that is what led to that book. And he's no longer diagnosed as type 2 diabetes. So it's clear that it's possible for many people with a dietary intervention and some lifestyle changes to arrest this before it gets to the place where the entire metabolic process is broken. Would you agree?
Absolutely, 100%. And again, just to reinforce your point, there are people who have hit that breaking point and have become diagnosed with full-blown type 2 diabetes, who can then eliminate grains, for example, from their diet and cut the carbohydrates by doing that, and completely reverse their diabetes.
Yeah,
that does happen, absolutely.
And then tell me this: if that's almost, I'm picking up from you and certainly from many other experts and from my own belief that the first order of business is to lower the carbohydrates. See if that works. You may get success with that, and you may not even have to go further. Why does the American Diabetes Association still recommend a high-carb diet for diabetes? Will you please explain that to me?
I'm sort of like a balanced thinker, and so I always want to know that also. It's a great question. I've asked myself that many, many times, and I'll actually research it. So I'll go to the source and say, what is this? And I go to American Diabetes Association scientific sessions, and I go to the diabetes educator.
Tell me, why?
So it's perspective. And so what they do is a couple of years ago, the American Diabetes Association did an experiment, and it didn't have anything to do with carbs, but they did say, let's just at least cut calories. Let's cut the amount of food that people are eating and see what happens. And they found that alone did make a big difference. In other words, people had better glycemic control. They didn't need as much medication. Their outcomes were better. But you know what they said at the end of that? It's not fair. It's not fair to ask someone with diabetes to have to eat differently than what everybody else does. So we're not going to recommend that, which is just a head scratcher. For me, it's like, well, then tell everybody to eat healthy, right? But so that's one part of it, is they just feel like it's not realistic. It's not fair to ask somebody to cut carbohydrates like this. There's two other reasons that I've come up with. The number two reason is this fear of hypoglycemia, severe hypoglycemia. Hypoglycemia is low blood sugar. And that is about the medications. So when you approach diabetes care from a conventional medical perspective, there's an assumption that the patient is going to be on drugs. And that's sort of the cornerstone of their treatment, unfortunately, which is backwards, we'll put it that way. But there's an assumption they're going to be taking medications, and many of those medications can lower blood sugar. So the dietary recommendations are a slave to that.
To the medical recommendations.
This
is the most amazing little pearl, and I have to. I try not to interject too much in these interviews, but I've got to. It's kind of like Coumadin. Which every adult, every parent of ours is on, and they tell them not to eat green leafy vegetables because they don't want it to interfere with the medication, rather than let's eat the foods you need and then we'll adjust the medication to the foods. No, it's all pharmaceutical centric, and that is just it's just more than a head scratcher. It's a Alice in Wonderland reality to me. I do not understand it at all.
It's absolutely insane. I can't agree with you more. And just on the Coumadin thing too. I mean, it's vitamin K2, for example, is known to sort of melt plaques and to actually help improve cardiovascular health.
Right.
And and there's lots of benefits for vitamin K.
Right.
And not to mention all the other things in leafy green vegetables.
Exactly.
And we're going to not eat those so that we can stay on our drug, which is supposed to help us prevent heart disease. It's insane. It really is absolutely insane. And it's the same thing with the diabetes meds. We're taking this drug to lower our blood sugar. And I've literally had clients say, I had to eat some sugar because my blood sugar was getting too low.
Well,
because they were taking the drug.
Don't these doctors still recommend that you could? I heard an interview with a famous actor on the radio, and he's type 2 diabetic, and they were talking to him about this, and he said, well, my doctor just tells me keep a candy bar in the car in case my blood sugar goes too low. Are you kidding? Are they really telling people this?
So you're taking a toxic pharmaceutical drug to bring your blood sugar down, and then you're eating a candy bar to bring it back up.
Keep the candy bar around just in case.
It's ridiculous.
It's crazy.
It is. You're right. Alice in Wonderland.
I know. So let me go to a subject that's very of personal interest to me because I wrote a book about it, obviously. High-fat diets. If I understand you correctly, and if carbohydrates have the most profound effect on the fat-storing hormone, excesses of which can lead to diabetes and all these other complications that we know are related to high levels of insulin. If carbohydrates have the most profound effect on insulin, protein has a in the middle of the road, kind of not as bad as carbohydrates, but still some. And fat has zero effect on insulin. Why are we not recommending high-fat diets for people who are either obese or diabetic and have some problem with carbohydrate metabolism?
We are, Johnny. But they're not.
Yeah.
Why is the conventional, medical paradigm still not recommending high-fat diets? That is a really good question. And again, I think it's just rooted, and you know this as well as anybody. It's rooted in these old beliefs that. There's two things.
Okay.
One is it's rooted in old beliefs that. Heart disease comes from cholesterol, and cholesterol comes from too much cholesterol or saturated fat in the diet. We now know that that is absolutely not true. And we know that even if coconut oil, for example, does raise cholesterol, it's raising good cholesterol. It's raising cholesterol in a good way, meaning large buoyant particles which are not prone to oxidation and they're not atherogenic, right? They don't cause plaques. So even if it does raise cholesterol, that's not a bad thing. And it doesn't raise triglycerides, which I think are the real enemy, so to speak, when you get the high triglycerides. So that's the first thing, is it's just rooted in old, misguided, misinformed, what's come to be known as common knowledge, which unfortunately is not common sense. The second thing is there is some direct evidence that elevated levels of free fatty acids, FFAs, so that's like the triglycerides minus the glycerol. So it's just the fatty acids themselves. Elevated levels of free fatty acids in the bloodstream are associated with insulin resistance and the progression into diabetes. So again, then they'll make this leap that says, well, if high free fatty acids in the blood cause insulin resistance and diabetes, then somebody with diabetes shouldn't be eating fat, or somebody who wants to prevent diabetes shouldn't be eating fat. Again, it's just misguided information. They're taking a conclusion and making assumptions about it. And I see this with some of my colleagues in diabetes care, especially some of the vegan proponents will say cut fat. Even the ones who recommend avoiding insulin and avoiding drugs and so forth, they'll still say cut fat because of this causative relationship between free fatty acids and insulin. What they don't realize, and this is the big point, is that it's not the fat that raises the free fatty acids. It's the high carbohydrate diet with the wrong fats that will raise the free fatty acids in the blood, because the body will then burn that starch and sugar, and that fat has nothing to do but circulate around in the bloodstream or get stored as fat. When you cut the carbs and you eat the right healthy fats, which are easily burned by the body, then your free fatty acids actually drop because you're burning that fat and you start burning your stored fat, which allows you to lose weight.
That's a really elegant explanation of that. I'm very, very grateful for that explanation. Let's just jump for a second to the area of supplements. I know that there's a lot of stuff on the internet and in magazines about, supplements that you can take for obesity or to lower blood sugar, to do all this stuff. What's your approach? What's the functional medicine approach to supplements that might help people to control this very metabolic irregularity, if you will, this, high blood sugar, high insulin, and the whole cascade of events that happens? Are there any supplements that might be helpful that you use in your practice that some of the people listening to this might be able to benefit from?
Yeah, absolutely. And I'll say first, food is the best medicine. So use your diet first and lifestyle. And then supplements are supplemental, but they can be really helpful. So there's a few things that will improve your body's ability to utilize glucose and your cells' degree of insulin sensitivity. In other words, how they respond to the hormone insulin. So some of the ones that have the most research behind them are chromium. Chromium polynicotinate is the one we recommend. There's also chromium picolinate, which is a very good form as well. That was nicknamed glucose tolerance factor because it actually allows you to utilize more glucose. The receptor itself has chromium embedded in it, and it has some functions around the uptake of glucose. So chromium can help to suppress appetite a little bit. It can help you to burn that glucose for fuel. Another one that I recommend is carnitine. Carnitine is a nutrient that actually helps you to transport those free fatty acids into the mitochondria, which are the metabolic machines in the cells. That's like your car's engine. So you got to get gas into the engine, and the best fuel to burn is fat. And carnitine helps you to actually bring that fat into your mitochondria to burn. So carnitine can be good. And as you burn more fat, your metabolism upregulates its fat burning. You'll in turn have better glucose and insulin balance and insulin control. Another one is curcumin. Curcumin is a spice that has been used for thousands and thousands of years. It's the main spice, the main spice in turmeric and curry. And curcumin is both anti-inflammatory, which can be really helpful. It has been shown to improve the function of beta cells, so the cells in the pancreas which make insulin, and it actually protects them from damage, which is important if you have high blood sugar because you want to protect those beta cells. And it's been shown to improve insulin sensitivity as well at the cell level. So curcumin is sort of an all-star here.
Yeah, I'm a big fan of curcumin. Now, just one little aside. Curcumin is not very well absorbed. Is that correct? I personally always recommend products like Terry Naturally, for example, uses BCM 95 curcumin, better absorbed than the average. So do you want to make any recommendations on what forms? Yeah,
I like that C3 curcumin.
C3 is a good one.
Yeah, sure. And the one that you mentioned.
Yeah. So those are great clinical pearls. Those three supplements, just right there. Vitamin D gets a lot of press. What's its role in this whole fat loss, diabetes regulation, this whole scenario? How does vitamin D fit in?
It seems like vitamin D does everything, doesn't it? I mean, vitamin D is just the vitamin all-star, and really not even a vitamin all, but a pro-hormone, and it's involved in so many things. It's obviously important for hormones and hormone production, cholesterol balance, bone health. It's involved in immune health. Obviously, it's an important part of immune function, and not widely known, but it actually has some effects surrounding the blood sugar system too.
Interesting.
So, yeah, it's very well known that low vitamin D levels are a predisposing factor to type 2 diabetes. So people with the lowest vitamin D have the greatest chance of developing diabetes.
Interesting. It's also true that people with the lowest levels of vitamin D have fiendishly difficult trouble losing weight. So it's very interesting that they're connected in that way.
Yeah. So we recommend keeping the vitamin D levels up at least in that 40 to 70 nanogram per deciliter range on a serum blood test. If you have autoimmune disease, usually you want it even higher than that. But certainly, I can't tell you how commonly I've seen single-digit vitamin D numbers, or it's in the low teens, and that's just that's one of those deal breakers, if you will. If you don't have good vitamin D levels, chances of regulating your blood sugar are very slim.
Yeah, good point. All right, let's close with something optimistic for people who want to lose fat, and they certainly don't want to be diabetic or pre-diabetic or have metabolic syndrome or any of the things that predispose you to all kinds of problems down the road. Is diabetes reversible?
Yes, absolutely it is. And even if you have full-blown type 2 diabetes, it is reversible. But I will caution that it's a much harder road. If you can catch yourself before the straw breaks the camel's back, before you jump into full-blown type 2 diabetes, you're going to have a much easier road. It's going to be much more successful. So, you want to take action in that if you have high blood sugar, prediabetes, metabolic syndrome, just elevated weight, obesity, now's the time to take action. Make the changes now that you would be motivated to make when you have type 2 diabetes or when you have that first heart attack. Don't wait. Make the changes now. Act as if. And if you do that, you can save your own life. You can save yourself from getting to that point.
What an inspiring and wonderful message. We have learned so much, and everybody who's listening to this, I hope you will listen to this again and again. I was taking notes, and I couldn't even write fast enough. So you'll want to take this interview home with you. Click the little thing right next to where you're watching and take it home with you and share this with people in your life who may be on the road to this. It's not a fun syndrome to have. It has lots of complications. You can avoid it. Please do what you need to do to avoid it. Dr. Brian Mowll, thank you so much for being with us. This was so helpful and so useful. And you have your own summit, the Diabetes Summit, which I can't recommend highly enough. It'll be probably out around the same time as this, so people can listen to both these summits and get even more information. And I always feel like they're never in competition with each other because, you hear the same, even if it's the same information said differently by a different expert with a slightly different, spin on it, and some little piece fits together that didn't fit before, and it's just such valuable stuff. You can't hear this message often enough, especially when we're fighting a sea of establishment medical and health professionals who are telling us to do the very same things that make us sick, fat, and tired and depressed to begin with. So Thank you very much.
Couldn't have said it better myself, Johnny. Thank you for having me on. I appreciate it.
Talk soon.